Okay, welcome again, and we'll get started. Good morning or good afternoon, everybody, and welcome to the webinar. My name is Dina Aronson, and I'm the Director of Nutrition Programming for Diet ID. We're so excited to be collaborating today with Spectrum Health, an integrated health system, which you will learn more about today during the presentation. Speaking on behalf of this fabulous organization are Kristi Artz, Leanne Mauriello, and Tibbe.
At Spectrum Health, lifestyle medicine is really the framework that we are using as a system to really think about and not just think about, but actually add health to healthcare and really striving to engage individuals in the context in which their health behaviors happen, which we know is in their daily lives and in their home. We weren't going to start, and we're not going to start the presentation with the statistics that all of you are familiar with around the prevalence of health behavior risks and chronic disease. But we should at least acknowledge that poor health behaviors really are our nation's greatest health risk, as they are the significant contributor to the development and progression of chronic disease. And to really be able to adequately and effectively engage and empower individuals to make not just change, but meaningful and sustained change, we must engage them frequently and in a way that is really personalized to them. And we acknowledge that that is not traditionally how healthcare is delivered, and why we are so passionate in really recognizing the need that lifestyle medicine is delivered differently because of the context of what lifestyle medicine is, a focus on those key lifestyle risks that we know can optimize health, prevent, manage, and reverse disease. So again, just a few comments kind of on this digital and virtual first approach. We know that lifestyle medicine is relevant for all. 95% of Americans have at least one significant, really substantial health behavior risk. So to even be able to wrap our head around reaching some meaningful number of individuals with lifestyle medicine, we really see digital and virtual as a necessary ingredient, as a way to successfully deliver lifestyle medicine. Additionally, as we talk about really reaching people in their homes, that brings us back to digital and virtual as really the only scalable way that we can reach consumers in the context of their health behaviors in their home. And that's why virtual care and telehealth, digital messages and digital health coaching, prescribing of apps, even the integration soon to come of remote devices are really integral to enabling our lifestyle medicine program at Spectrum Health.
So as Leanne was mentioning, around at least 95% of our population having at least one health behavior risk, and thinking about where do these behaviors typically happen? They happen in the home, they happen in places of work. Certainly they don't happen in the context of a physician visit. And knowing that and really thinking and reimagining how we can help patients, empower patients, really meet them where they're at when they're ready to make changes, speaks to the need to re-envision what a medical practice in lifestyle medicine even looks like. So here's our lifestyle medicine headquarters. This is where our practice is located, in a hands-on teaching kitchen space. A large portion of, as I mentioned, food as medicine, and being in a teaching kitchen site speaks also to the fact that many of our health behaviors are centered around what happens in the kitchen at home, whether that is how we connect with our friends and family, if that is where we're hopefully preparing our meals that are going to, drive health for a lifetime. But the teaching kitchen isn't only a teaching kitchen, it's also the place that we have set up where patients can come and have their full medical assessment with their lifestyle medicine physician and team. We have point of care biometric assessment here on site, such that we can be measuring a patient's lipid profile, diabetes markers. We're able to measure body composition on an in-body scale, which has been a really fantastic tool that we've implemented with our initial patient assessments. And then they connect with their entire lifestyle medicine team, again, whether that's in person or virtually. So our team would include physicians, registered dietitians, health coaches, chefs, tobacco treatment specialists, amongst others, who really can provide wraparound services for our patients and support them in the ways that they need. This is what we look like now in the teaching kitchen space. This is our culinary medicine program manager, Chef Elizabeth Suvetti, who happens to be just as comfortable in front of a camera as she is in front of a room full of patients or consumers. So you can see we've kind of amped up our teaching kitchen space to include more visual equipment, and we have delivered since April almost 50 virtual culinary medicine classes. And the way that that would look is we would have our team often on site in our teaching kitchen space, connecting with participants in their home kitchens. They'd be cooking alongside of them. Our dietitian would be adding in nutrition information all throughout the actual cooking process. So patient can then experience, what it looks like to cook a nutrient dense meal at home, and they can also have that support from the chef and dietitian while they learn hopefully some new skills and concepts.
Yeah, our first opportunity to really launch a nearly all virtual lifestyle medicine program came this past fall, and we were really excited because they were groups of our own Spectrum Health employees. Those groups are also very near and dear to Dr. Artz and myself as we facilitated those two group sessions together. And the two groups were enrolled into the Complete Health Improvement Program, with which Dr. Artz introduced in her earlier slide. And that stands for, or we call it CHIP, so Complete Health Improvement Program. And CHIP is an evidence-based lifestyle medicine solution that takes a holistic approach to health and really provides guidance in each pillar of lifestyle medicine. The initial groups of CHIP participants were recruited into the program through partnering primary care offices within Spectrum Health. And these patients were identified by having biometric markers that included a BMI of greater than 30 plus 2 additional comorbidities. And each patient was onboarded through the program by completing assessments, which are very important to us on the lifestyle medicine team. And those assessments are Diet ID's digital diet quality assessment, our lifestyle medicine practices health risk assessment, and then also that biometric point of care test that Dr. Artz referred to as well. And those are done 3 times throughout the program. So they're done before CHIP begins, at the 8-week mark of the 10-week program, and then also 6 months after the initial biometric screen, which would be 3 months after CHIP is over, after it ends. And so by being able to collect those data points the 3 times throughout the program, we are really able to see the change in diet quality and in the other areas of lifestyle medicine as well. So enhancing the curriculum for CHIP to thoughtfully bring in the technology and boost our patient experience has been really important for us. And how we've been able to really focus this shift is through adding in health coaching to the CHIP curriculum, bringing in our culinary medicine team, as Dr. Artz mentioned, delivering even app prescriptions and providing recommendations around apps that may aid in patients' everyday lives, and then also including subject matter experts as guests during some of our CHIP sessions as they align with appropriately with the CHIP curriculum. Health coaching is the biggest addition to the CHIP curriculum on our end. And what we have really done is created digital coaching experience for the CHIP groups, allowing us as coaches to connect with the patients for 6 months throughout the experience. So during the 3 months of the CHIP program, and then 3 months after CHIP ends. And we connect with them through virtual messages, through the patient's health portal. We use MyChart. And then we also have 5 virtual encounters with the participants throughout that 6-month span, which is well beyond the 10 weeks of the CHIP program. And we feel that by giving the opportunity to go virtual, we've had more participation, especially since this was from our employees. It's given them, since we are a healthcare system, and with the pandemic, it's put in extra stressors on our employees, and it's given them the opportunity to jump into these CHIP sessions without having to drive anywhere, and then continue to engage with the other participants throughout the day and on the weekends.
The virtual and digital experience does not create a barrier such that those interpersonal relationships really still can thrive, can provide that accountability that patients need in real time. With CHIP, we have this incredible foundation of the CHIP hub and the curriculum. As Kara mentioned, really layering in this virtual digital approach and scaling it has allowed us to, make it accessible. But we also then, when we layer in the biometric evaluation, it's helpful when I sit down with patients and review that with them. I say, it's really important that you understand your numbers, to know where you're starting from, to also look at what your health goal is. And now let's not focus so much on the numbers. Let's focus on the lifestyle changes that CHIP is going to allow you to engage with, and let's let the numbers take care of themselves. With implementing Diet ID as that diet quality assessment for our patients, it becomes almost like a game to patients to really enter into seeing where they are with their dietary pattern, to really understand what it looks like visually, what they're eating. And then on the back end, nutritionally, we can have more information as a medical team to see where are they consuming most of their energy and calories, what does their diet pattern truly look like. But to be able to get that very rapid assessment has been so helpful as we onboard patients into a program like CHIP, and also as we follow patients longitudinally and see that delta, see what's happening and changing in real time with patients. So what we were able to see in 8 weeks time were some really dramatic changes, and diet quality has always been the approach that we've taken as a lifestyle medicine team. Rather than focusing on a weight change or even a cholesterol change, we go with a diet quality change first, knowing that, or what we believe to be would be a leading metric. So if we're seeing a significant change in the quality of a patient's diet, we would expect then to see at some point, either in real time then or down the road, improvements in their lipid profile, their diabetic biometrics, and so on and so forth. So what we've seen here is some of the main features of that improved diet quality that we thought we wanted to demonstrate here with our own small panel of patients. So in terms of added sugar, we saw a dramatic decrease, saturated fat as well, and sodium. And what we're seeing and hearing from our patients is that as they move toward a diet centered on whole plant foods, or foods as grown, is how we speak about it in the CHIP curriculum, we can see that they're removing sources of added sugar from their diet, that they're, in terms of the saturated fat change, we're seeing a significant reduction in animal product consumption, whether it's usually a combination of both meat and dairy, being replaced with things like beans and whole grains. And that oftentimes also corresponds with where we're seeing that decline in sodium intake between the animal products and also removal of a lot of the other processed foods that they may have been eating. It's nice to be able to have patients work with our chef and dietitian, with our culinary medicine team in the CHIP program, so that we can really coach them through making those changes more slowly if that's necessary. But even in a slow amount of time, we're seeing this dramatic increase in fiber in just 8 weeks. So, from 25 grams to 60, almost 70 grams of fiber. If you go to the next slide, please. And with that, we are seeing really impressive improvements in their biometric assessment. So at 8 weeks time, we invite patients to come back to the practice and have their lipids rechecked, their A1C, their fasting glucose, to jump back on the in-body scale and see how we're doing with our body composition analysis. And all of our markers that we were hoping to see patients have improvement in, they all improved 100%, and we're just thrilled with the results that we're seeing. So we've seen a dramatic decrease in weight. On average, we're seeing a change of about 11 pounds. Some patients have seen changes of close to 20 pounds in that 8 weeks time. We oftentimes have to slow some of them down a little bit in terms of their weight loss. We're seeing great improvements in total cholesterol. A couple of our patients have realized a 50 to 60 point drop in their total cholesterol and their LDL cholesterol, anywhere from 30 to 40 point drop in LDL cholesterol. They're hearing the information that a total cholesterol of 200 may not be optimal, when in fact getting closer to a total cholesterol level of 150 or 160 to really dramatically reduce cardiovascular risk, we're seeing our patients get there through diet changes alone. We've also been able to de-escalate therapy for many of our patients, meaning that within even a couple weeks, some of our patients, we had to start reducing their antihypertensive medications. And 2 of them were able to come off their antihypertensives completely. We have a few other patients that had been taking over-the-counter medications for reflux. Their reflux symptoms essentially disappeared. And so they stopped taking those medications. And we've even seen reductions in need for insulin usage. All of these changes and biometric improvements truly would be expected. It's just really fantastic to be able to see this happen with real numbers in real time, and to be tracking this very intensively with our patients, and on a more in an aggregate level, to really see at scale the power of lifestyle medicine and what we can do when we bring this to a community.
Certainly in the early days of the development of this all coming to fruition, one of the things we really grappled with was, how do we collect great diet quality data, multiple time points, in a way that will be efficient? And Diet ID was and has proven to be the perfect solution for that.
And what we do is make it possible to capture comprehensive diet quality and down to the level of nutrient intake in about a minute.
Of course, as we've mentioned, we are interested in helping patients improve the quality of their diet. We're not here to dictate what an optimal diet looks like, but yet every program and offering that we bring is based on the science that's available to us, the best available science, and then partnering with patients to really support them to become almost their cheerleader in a way, to help them make changes that they're ready and feel equipped to make, that are also going to be sustainable for them.
I just want to comment briefly from the Diet ID perspective. So first of all, we are not building dietary assessment around anybody's personal preference. We're building around objective measures of diet quality that are directly correlated in a vast amount of robust epidemiologic research against all-cause mortality and total chronic disease risk. So our diet map includes diets all the way from paleo and low carb to whole food, plant exclusive, and variations on the theme of veganism, and everything in between: Mediterranean, flexitarian, pescatarian. The highest quality versions of all of those are plant predominant, but they're obviously variants on a theme. We think the beauty of offering people that range of goal diets is ultimately, you're the boss of you, nobody else is. And that empowers you to love the food that loves you back.
Thank you so much. So we are out of time. I wanted to share the website for everybody one last time: spectrumhealth.org/lifestyle medicine, to learn a lot more about the program and to answer some of your questions.
We know the road ahead is exciting, but we also know it's long. And our goal is really, how can we reach hundreds, if not thousands, to help really support and create a healthier community in West Michigan and beyond.